to start off with the socioeconomics of COVID, what we're going to do is we're going to talk about a central question that has been plaguing basically anybody who's been looking at the effects and the aftermath of COVID. And the question that they have is, was the response to the pandemic a response that was effective in mitigating the virus? And was the response, and basically what it's asking is, was the response worth it given everything that's happened in the aftermath?
I think it's just asking was it effective? They aren't really able to talk about the worth because they don't talk about costs at all.
Well, I'm saying in general, like this is a question that people are curious about. So in general, people are curious, like, were our interventions worth it? And were our interventions worth it comes down to being able to balance the cost benefit of the situation. The cost is that if you lock everybody down, you lose economic power, you lose sociability, you imprint poorly on children that are in this developmental age. The elderly that are lonely become isolated. You undermine all of the structures of society that are valuable. People lose their jobs, right?
And we're going to go through a paper. We could do that first too, but I did pull a paper that outlines the various costs, which might be interesting.
Right, and I think that those are really, really important, but I think that before we look at the costs, it's worth looking to see, did the intervention work? And this is a paper that asks that question. Did this intervention work? And this is a hugely difficult problem, because how do you evaluate whether an intervention works given that you have done the intervention, right? Because you've changed the world. You've locked people down. You've kept them in their houses. You've basically said that this is our baseline. Once you shift the baseline through some kind of intervention, it's very, very difficult to compare like pre-intervention and post-intervention and be like, well, the intervention worked. Because with something that's a respiratory disease, you have lots of seasonal changes. You have the fact that as it passes through a population, mortality will be different. You cannot compare directly. And so what this paper does is it compares kind of indirectly, and we're going to go through some of the statistics of how they do that, the study design, the way that they filter their studies, what they come up with, and then we'll talk about what the economic and the social outcomes were, and then we'll talk about those outcomes in light of this study. Does that sound reasonable?
Yeah, I just want to say one more thing just to clarify it. The study was only interested in addressing whether lockdowns could or could not have reduced COVID-19 mortality. So they didn't look at anything other than mortality. And they weren't able to, well, we'll get into that later, but the way that they chose to look at mortality was not totally ideal either, because they weren't able to look at it against all-cause mortality from previous years.
Well, so let's talk about all-cause mortality versus COVID-19 mortality. Do you want to?
Go ahead.
Are you sure?
Yeah, I'm not there yet. I mean, I want to get through some of this stuff.
So basically, what Dr. DeLay is saying is that they look at a bunch of different studies in this design. I think 30.
We're going to get to that, so.
Yeah, we're going to get to that in a second.
They started with 18,590 studies that could potentially address the belief that lockdowns do reduce COVID-19 mortality. However, of that almost 20,000 studies, they only pull 34 that they deem qualified.
And of those qualified ones, they only use 24. So we start with a body of 18,000 papers and end up with 24 that we're basing our analysis on.
By the way, do you want to say anything about like the impact of this paper? Do you think that this is this a famous paper?
The impact of this paper. I think that as soon as this paper came out, there was basically people that were starting to say that it didn't say what it purported to say. There were people that used it as substantive evidence to support their opinion, like any scientific paper.
And obviously Johns Hopkins is like one of the premier medical universities in the world. And so a paper coming out like this that's basically claiming that lockdowns didn't help with mortality took a lot of flack. So I think what's really interesting right out of the gate, though, is that very few of the studies were used for this meta-study. So whatever conclusions they draw, they're based on a very limited subset of information. And they do have an objective way of going about this, as do all studies. But this is a huge problem in science in general, which is how do you remain objective when you're doing aggressive filtering, right? In almost every discipline I can think of, there are filtering stages where you have a really noisy set of data and you're looking for this one thing. But, what's a good way to, I can think of musical analogies or something, but if you just look for some frequency in a bunch of white noise and you have like a really tight equalizer on it and you just bump one frequency and you just look for it, you can get something that sounds like a tone at every single frequency if you just narrow it down to that. And so there's definitely, I think the most important thing we can learn from going through this is, or one things we can consider as we read this is, were there decisions for what to qualify and what to disqualify? Were those the best criteria? Were they reasonable criteria? Were they the best criteria? What criteria can we think of that maybe should have been included as well? Because the conclusions obviously are pretty damning. And if their filtering technique was not absolutely top shelf, then you're just looking at somebody making a note out of noise. So let's do it.
Yeah. I mean, the conclusion, before we dive into the body of the paper, is that based off of their meta-analysis of these 24 papers, which they filtered so heavily because they were like, these are the only papers that are capable of answering the question that we are asking. And we'll talk about the quality of how they selected those a little bit down the road. But they're basically saying that of these papers that answer our question, they show that COVID mortality is reduced by 0.2% on average from lockdowns. And that's not great. They also say that stay-in-place orders, which are the softer recommendation-based lockdowns rather than actual like curfew lockdowns, are also ineffective, where they only reduce the mortality by about 3%. And so it seems to be that there's no concise intervention from their perspective that on the level of preventing people from mixing and interacting with each other would actually stop COVID mortality. And we're going to get to why that is the case, because that initially seems like a counterintuitive claim, right? Because you're like, well, look, if you lock people down and you don't let them interact, then you would expect there to be a decrease in the number of cases. How could they possibly have the same number of cases? That's crazy. But what it comes down to is this flatten the curve idea, because at the beginning of the pandemic, there was this very, very common and frequent refrain: flatten the curve. 2 weeks to flatten the curve, right? And the idea was that what we were going to do is that we were going to lock down and we were going to lower the number of cases. And by lowering the number of cases, we would prevent the hospital systems from becoming overwhelmed. And in theory, that works, because if you have fewer cases happening at once, you end up having less of a strain on your hospital system. But what it doesn't take into account is the fact that if you carry that out moving forward, you're going to get the same number of cases in total if you look at a wide enough range of time. And so a lockdown and quarantine and all of this stuff seems like it's really effective. But then when you zoom out a little bit, you're like, oh, but over enough time and enough mixtures, the people who are going to die from the virus, or the people who are going to get sick terribly from the virus and then die of something else, are still going to meet that same fate whether or not we lock down. And that's the argument here.
It's also, and they talk about this right out of the gate too, that this comes in response, if we all think back to early 2020, there was this cited Imperial College London study that essentially said that if we locked down, we could reduce COVID mortality by up to 98%. So we could basically stop people from dying.
And this is a really, really, really well-cited article. Would you agree with that?
Yeah, it's also entirely based on simulations. I don't know. It's also like, this is the weird thing about simulations. If you forget to input some factor into it, like Dr. Bennerberry just pointed out, that this is going to come to an end at some point, and people are going to have to leave their house at some point, at which case the death will resume, right? So I don't think it was bounded properly. I honestly haven't read it, but I know it was highly referenced. And obviously it was complete garbage because it didn't reduce mortality by 98%. No matter what you think. Maybe they worked as high as 30-something% like the CDC study referenced here, we'll get to in a minute, shows, but 98% is absolutely out of the question. I think there was another Imperial London College study that, was it the same group that estimated mortality overall was going to be like in the 65 million?
What's weird is that I have looked for that paper.
Right. It's just been scrubbed.
So there was a weird paper right at the beginning of the pandemic that I remember looking at, and it's somewhere in the annals of my family chat, because I remember sending it to them and being very worried about this, where this same group from Ferguson et al. Said that the world's death toll from COVID is going to be about 65 million. And I cannot find that paper. And so we can't necessarily return to it. But this paper purports that the death toll is going to be, I want to say 8 million in the United States. And so it's just this hugely high estimate of death toll that is not based on real numbers, because you don't have real numbers for a pandemic that's not going to happen yet. You have to create a model for what you think the R naught is, which is the number of people each case infects. And then you also have to take an estimate for how the case fatality rate is going to play out. And both R naught and the case fatality rate in most of these early models were way off from reality.
So the authors here said that they looked at that, and then they looked at a few studies that came out right afterwards that showed that the growth rate that was predicted in the first paper didn't play out, because daily deaths, it seemed like, had this initial high and then closed down after about a month in each of the regions. I think they were looking at, it says across all countries and US states that they studied.
Mm-hmm.
So they're like, those kinetics don't actually persist, so this doesn't totally make sense to us.
And we kind of saw this too, where when we were looking at the studies of the deaths in Italy, where you see this very fast spike, and then you see a very fast decrease in the number of deaths. And we saw that seasonally with each wave of COVID, where you would have this wave, you would have a lot of deaths, and then it would come back down. And if you are predicting using that part of the curve that's going straight up, and you're not taking into account how sharp that turnaround is going to be, or at what point it's going to start turning around, you can have a really robust looking model that gives you something that doesn't make sense.
And then the third factor that motivated them to check out this question was they couldn't find a negative correlation between the stringency of lockdowns and, I guess I should say it this way, between deaths, mortality, and stringency of lockdowns. In fact, if you look at these two figures down below, it's a really weak positive correlation. And so they were like, what's going on here? Obviously, that correlation is complete garbage. So you can't really say anything one way or the other. Just so you guys who haven't taken statistics, for a really tight correlation, that R-squared value should be close to 0.9.
Should be close to 1, right?
Yeah, close to 1.
So basically, you would expect that if stringency of lockdown, so down here on the x-axis they have average stringency. Average stringency.
I made a little slide for that too, for the stringency scale, which was kind of confusing.
Oh, let's look at it. That's a great idea.
Yeah.
This?
So we could check this out. Let's go back to that. The one slide after this tells us what they scored it based on. There you go.
This one?
Here we go.
Mm.
So they basically concocted this stringency scale based on these factors here: containment, closure policies, economic policies, income support, health system policies such as testing regimes, emergency investments into healthcare, Vaccine policies. So pretty standard like government response stuff, aside from the containment and closure, which is C1 through C8. And each one of these was given a certain weighting. Like it's somewhat arbitrary, except it is applied universally across all these different countries. And then they come up with this heat map, which is up here, which is kind of fascinating. I wish we could do it in real time. Maybe we can just go to the...
This way, yeah.
Can you get into this non-speaker view? Because we could actually pull up that website, maybe. Think it's worth it?
Sure.
It's kind of cool. It's a cool figure. I put it down in the notes. No, not that. If you go to the heat map, yeah. Yeah, so you can see the countries up here. Generally, the darker that the color is, I guess nobody ever really hits 90 plus or even 80 plus. But then if you go down, you can move this time ticker across. This is across 2021 to present, I think.
It's just 2021. This is just 2022.
Just 2022. Okay, so we could do a different time period. But it's really fascinating how there's sort of there's a very lockstep appearance and disappearance of these different policies, right? Up to the present, where everybody's just like, nope.
I'm perplexed by this because this is a single day of difference, and it suggests that stringency increased between 13th and 14th of April of this month, which I don't remember.
I think it did because there was a new wave that came out.
Strange.
Yeah, I saw some lockdowns were happening. I think what was it, Pennsylvania or somewhere in this country? Somebody can correct me on that later.
Strange.
Yeah, go back to like April. Go back to 2020 or something. Let's check that out.
Okay.
This is important because the entire conclusions of this paper are based on this stringency reporting. And this scale was established by Oxford University, I believe. Don't let us down.
All right, there we go.
So, wow.
All right, so basically what we can see is that when we start January 1st, nothing is happening in the world, and then China
goes into steep lockdown.
And then it spreads basically through the rest of the entire world.
Wow, I guess some of them did get into the 90s back in 2020.
Right. And so by the time that we hit the summer of 2020, we're starting to see that lockdowns are starting to kind of chill out a little bit. And so when we look at the efficacy of lockdowns, what we're looking at is we're looking at this window of time here, where it's early in the pandemic. Everybody started freaking out right around here, right? You can see it like not really anything. There's some like chill stuff happening at the beginning of March. Obviously, China's already at 80 plus. But there's still kind of this Mongolia's just chilling, 60, about halfway up the scale. But then over the course of March, you really start to see that by the end of March, we have hit a very different world where there's nobody left on the map except for...
China's kind of chilling out a little bit.
Yeah, China's starting to chill out at this point. Well, because they locked down super early. And so there's a couple of African countries that have relaxed regulations, but basically everybody else is very strictly worried. And so the question is, did this help? Because you see also as we keep moving forward that by the end of the summer, basically everybody except for China
and
the US have kind of started to ease restrictions. And this kind of, now you start to see a little bit like it's not as concerted anymore, because in the first wave of lockdowns, what they say in the paper, which is really interesting, is that countries were deciding to do this not necessarily because they had derived de novo that a lockdown was going to be a good idea because they had some kind of data that suggested that it would be a good idea, but they were locking down because everybody else around them was locking down. And so you can kind of see it spread around the world by neighboring countries. And so countries did what the countries next to them were doing because that's what made sense. And if you continue scrolling through this, you end up basically in our present day, which is the fact that things have significantly chilled out. And so we're talking about early in the pandemic when we ask the question of, do lockdowns matter? Where do I keep putting this? Here we go. Okay.
So this correlation was actually slightly positive.
And that is insane. That's insane. Like we can't just like gloss over this as if it's not just an absolutely startling finding. Like, I really value our world in data. I think that it's one of the best resources that we have for being able to actually visualize data. And the fact that they put together this and it shows that as you increase stringency, there is no real correlation between the number of deaths you have per million, that just blows my mind. Like, that shouldn't be the case for an intervention that works by keeping people from being in contact with each other.
Except it seems to be also the way that it played out with the first pandemic in the Spanish flu. They talk about that in the discussion section. We'll get to it.
Okay. So basically, it remains an open question as to whether lockdowns were effective. Because they looked at this data and they're like, look, Max Rosner and Our World in Data puts this together. But that doesn't necessarily mean that what they've done is they've actually crunched the numbers as well as we could. So we're going to crunch the numbers and we're going to do a meta-analysis. So and they're going to look at this using a counterfactual difference in difference approach. And so this is basically a statistical tool. The statistical tool and the way that it works is pretty straightforward. It is examining the differences between two events that previously were running parallel and now are not. And so you basically have two different conditions. You have your group that does the intervention, which is shown up here at the top. And then you have your group that doesn't do the intervention. And before you did the intervention, they were developing similarly. And so you would basically look and you would see these curves of COVID cases skyrocketing. And so you look at Sweden, you look at Norway, you look at the United States, you look at China. The curve of COVID increase is very similar in all of these places. And then Sweden doesn't do a lockdown. All of the other countries do, and so you're comparing what happens in all of the other countries basically against Sweden. There's different ways of doing this, right? Because you can do this as being a factual outcome where you actually do this in retrospect, or you do this as a synthesis outcome where what you do is you basically just create a model where you come up with data that you think is going to happen here, and then use that as the basis for your analysis. And obviously the authors are like, we wanted to look at real world data because looking at this hypothetical model-based synthesis version of the world wasn't actually going to give us a real estimate of what was happening. All right.
So now we get into how they chose the 34 studies out of the initial 18,590 studies. And honestly, I think that this is a little unsatisfying because they trim off most of them based on the title. And there's not much explanation given as to why they went from being in the Big Ben to being in the title friendly. Like, did you get the impression that they just pulled 18,000 COVID studies, period? And then they only kept the studies at that, like, maybe it sounds bigger than it is. That's what I'm getting at, because it says they pulled all of the studies, they pulled 1,000 of them out of 18,000 that had something in the title about lockdowns and deaths.
So this is the problem with meta-analysis, right? So you do a search and you come up with 20,000 titles. You can't look at 20,000 titles. You don't have enough grad students. You don't have enough postdocs. You don't have enough people in the world.
They want to look at the data from those too. They didn't want to just look at the conclusions of the authors too. They wanted to re-examine the data themselves.
And so it's just... You have to filter stringently. And so you can't really fault them for settling down on so few papers because you can't possibly look at 20,000 and you have to have some way of actually moving forward and being able to do the filtering. But I have a feeling that because of how poorly people title their science papers, it's entirely possible that they threw stuff away that they should have looked at.
Yeah, like maybe there were 18,000 studies that had the word lockdown in them.
Right.
Lockdown or death in them or something.
Yeah, exactly. And so by the time that they get down here, they've already gotten rid of most of them. And then they're looking at 117 studies and they're trying to figure out their eligibility. Okay. And of those, 83 they excluded because a bunch of them were...
Just skipped one step though. They asked these questions.
Oh, yes. Sorry.
Yeah, go back up one more. So they screened the 1,000 studies that remained and they asked if they could answer the questions that it measures an effect of lockdowns on mortality and uses some empirical approach to do that.
Again, which is fine.
What's a non-empirical approach?
Where they just talk about stuff? I don't know.
Yeah, like I don't even know.
Yeah, like that's
just an
kind of
essay
weird.
Or something. Okay, that's weird.
Yeah, that's true because it doesn't necessarily. It could just be an opinion. It could be a think piece. It could be a letter to the editor. Like there's lots of different scientific publications that are not necessarily.
So most of them, 931, were able to say yes to.
No, most of them said no.
Oh, 931 were excluded.
Yeah.
Whoops, my bad.
Okay, so then you have 117 studies, and out of those, they threw away 83.
That's amazing. So 900 of them were somehow not empirical or didn't. They were talking about lockdowns and mortality, but not measuring mortality.
Which makes me wonder what the state of the literature is. But I didn't go look at the state of the literature, so I remain agnostic on this. But then they had to exclude a bunch of them because they were like... Even though they were looking at these questions and they were looking at lockdowns and mortality, they ended up with 9 that weren't actually looking at mortality. One was just purely descriptive, which uses an empirical approach, seems like they shouldn't be there.
Right.
Then a bunch of them used modeling. A bunch of them looked at timing, which we'll get into a little bit later because they talk about the importance of the timing of the lockdown and how that reflects on measurement. But these studies were literally just looking at early lockdown versus late lockdown.
3 of them were like people's senior theses or something.
They were like, we don't need any student papers. 2 somehow didn't look at the effect of lockdowns. And then 10 were these synthetic control studies where instead of taking a control which was actually happening in the world, which was a realistic measure, they basically just came up with a model that they were like, this is a more realistic model for what's going to happen versus what actually happened.
So when you think about the fact that they only base their conclusions on 34 studies at the end of the day, this last step is where you really want to look hard at whether these are good decisions or not. Like this one, 9 of these studies that would definitely change the statistics at the end of the day had too few observations. What does that even mean? I don't know. This is just, there's so much subjectivity in this step and it could impact the outcome of this study so heavily. So that's worth pointing out.
It's something that I kept thinking about over and over again when I was looking at this, where I was like, all of this data is publicly available at this point. And so instead of spending the money on doing the meta-analysis, why didn't you just go and crunch the numbers raw from public databases? And I don't know the answer to that question. Because it seems to me that it would be a similar amount of effort to doing a huge meta-analysis as it would be to actually go to these databases and be able to come up with an empirical test of before and after. For some reason, they didn't do it. And that unnerves me more than anything because you would expect that somebody has the wherewithal to go through all of these papers and be like, this is what a good paper looks like. Might as well just do the analysis themselves. But they didn't. So that's interesting.
I see. Then we have all the details here.
Mm-hmm.
Yeah, exactly. So they were just looking for things like death and mortality and COVID originally. Anyways, I think it's a reasonable filter set, except for I'm a little concerned about 9 that didn't have enough data. The rest of it seems reasonable to me.
All right, and they did have two. So basically, when they went through all of this, they had each study of the 117 that they were deciding whether or not to keep were assessed by at least two of the researchers. So at the very least, there was some quality control where they had to agree on what studies they were actually going to throw out. Oh, the not enough observations was a jurisdictional variance, and they talk about this in the paper. And the jurisdictional variance was, they were like, if you are comparing bins of countries that just have one country in them, you don't have enough countries in each one of your bins. Like if you're trying to compare Norway versus Sweden versus Denmark, those are three different approaches to lockdowns, one of which is Sweden is barely no lockdown, Norway is a stay-in-place order, and Denmark, I think, is a stringent lockdown. They're like, you can't make that comparison and have it be effective. You would need to have a couple of countries that have stay-in-place orders. You have to have a couple of countries that have strict lockdowns, and then you have to have a couple of and then you can compare those against the country that had nothing, and then be able to say something. But they're basically like an N of 1 is insufficient to be able to generate robust data, which again I stand by. However, there's going to be an interesting fact with this later, because when we start looking at how they actually used the papers and how they based their own statistical analysis, they viewed apparently that having one paper that showed something was sufficient to be able to lean on it to say that this was robust data. And so it's this power of large numbers where the study had a lot of data points, and so they can trust that study. And so they only have one data point, but it's kind of this like meta data point, which is meta-analysis. All right. Yes, so they disregard all ex-ante studies, which is that the results from these studies are determined by model assumptions and calibrations. All models are bad, but some are useful, is the kind of catchy, pithy phrase. And this is very true here, because depending on the way that you construct your model, you're going to get totally wild outcomes. You can't rely on a model when you're trying to figure out if something works in the past. You got to use real data. Where are you at?
Just following along. I guess my highlights didn't save.
All right. So then they what I like is that they periodically stop and they really make a point where they're like, okay, so we excluded this paper and it was very popular, and we're going to explain to you why we excluded it. So for example, they excluded this Flaxman et al. And Flaxman et al. Suggested that lockdown saved 3 million lives in Europe, which, if that was the case, this is way beyond their 0.2 to 3% lives saved for lockdowns. So then they make the point where the reason that this doesn't hold is because of the way that they make their assumption. So there's a reproducibility time for COVID, and that's a reproduction rate. This is this R sub T. And what they're saying is that when they made this paper and they made the assumption that they're like 3 million people more would have died if they hadn't locked down, they were assuming that there was going to be no seasonality or change in the way that COVID was spreading through the population, either because of, like I said, the seasonality change, or because people changed their behavior, which the minute that you start doing an intervention in one country, people are going to start behaving differently in another country. And so because it doesn't take into account the way that those things would change, then it's not a good analysis, because it's making a bunch of assumptions that don't appear to be real-world assumptions.
One of the authors is from Sweden, by the way.
Of this paper?
Mm-hmm.
Interesting.
The other one's from Denmark, and then the lead author is from Johns Hopkins.
Right, and so they're like, preferably the way that you would be testing the effect of lockdowns is through controlled trials, but that doesn't really exist. We don't have that in the world. Even in China, the lockdowns are not controlled, right? There's not like a group that gets locked down and doesn't get locked down. So we talked about the synthetic control. So you construct a synthetic control which functions as your counterfactual, and your counterfactual is this like group in which your intervention didn't happen. right? And so they justify by saying that the synthetic control version of a country like Sweden that was published deviates substantially from what actually happened in Sweden, and so they're suspicious of the entire enterprise. Which I think that
most of this paper is them justifying their filtering methods.
Which is pretty fantastic, because that's basically the biggest complaints that I had with the paper, where I was like, look, you can crunch numbers all day long and get whatever you want to show me, but I need to be certain that you've crunched your numbers in a way that I can reliably at least follow your logic, because that's kind of what science is about. You have to set down a presentation that somebody can follow, somebody can understand, somebody can evaluate your axiomatic assumptions, and if you agree with them along the entire process, and you're basically like, okay, yeah, you can do that, you can do that, you can do that, and they come to a conclusion that you don't like, them's the breaks. You're just stuck with the fact that they've done good work and they've arrived at a conclusion that you don't like, but you can't argue with the conclusion because you've agreed to all of the assumptions that go into it. And that's a kind of a crazy part of this paper, because they do end up at a conclusion where I intuitively am like, that's crazy, but their logic does appear to be more or less sound. There's a couple places where I'm a little about it.
And all that's not to say that somebody couldn't come up with an equally logical argument for something totally different.
Right, because you can't know everything. You can only know some pieces. So always you have to remember that if there is a difference, there is a non-negligible risk that differences are caused by much more than just differences in lockdowns. You have to control for these things statistically, and that's just that is the breaks. One of the things that they point out is that they come back to this Auger et al. Paper, and they found that never mind, actually I'll come back to Auger later. Never mind. Okay. The role of optimal timing. The question of optimal timing is valuable because depending on if you lock down early versus if you lock down late, you're going to have different results, right? So it's like if you're a country that's in the very, very first wave of lockdowns and you manage to tamp down your COVID infections and your COVID fatalities, you're going to fare better than a country that waits several weeks for things to come out. They point to Italy, where they're like, look, the first day of Italy, when the WHO declares a pandemic, there are 178 COVID deaths per million already. And so the rate at which this was climbing was already really fast. And so these countries that locked down first could have had kind of a shift in the way that the analysis worked. And then you are...
It's also very difficult to tell the difference between people acting of their own accord and being more careful versus people being forced into their homes or unable to go out. I actually was looking at a few other studies about from specific countries about the efficacy of lockdowns, and it seems like they were actually survey studies where they'd call people and be like, hey, so during the lockdown weeks, like excuse me, did you actually stay inside of your house, and like did you actually do this? And pretty much the majority of people were like, no, like we didn't actually stay locked down. Or we had people over, like we violated all these rules in our own little ways, basically, which I think plays into that.
Right. So, and this is kind of the tricky part of looking at the real world, where you want to look at this intervention, but how well the intervention is being taken isn't the same thing as if you've got somebody in a hospital bed and you have a nurse coming by once a day and giving them some, drip of your experimental drug. And this you see this in all kinds of observational studies in general, which is that if you go into the world and you ask people, like, how often do you exercise? And then you're trying to correlate, risk health outcomes from self-reporting, you're really not going to do well, because people lie, people misrepresent, people forget, people misremember, all of
Everybody
the above.
Everybody thinks they eat better than they do.
Yeah, absolutely.
which is why, I mean, like what you said at the beginning, I think the most interesting part, like I might just skip to the end and get to where they talk about why they think this came out to be the case. I mean, because you talk about at the beginning, there's no correlation between stringency. I mean, even if this study is completely garbage, it starts with this multiply verified finding that there's no correlation between stringency and mortality. That makes almost no sense whatsoever for a contagious disease. And so the question is, why in the world would it not work? Because it seems like it should work is the thing.
Yeah.
So even regardless of whether you buy this meta-analysis or not, what's going on? And it seems like the authors have a few ideas, but certainly one of them is that people basically work around lockdowns anyways.
Yeah, let's look at these. So we're going to skip past this table. This is basically just a table of everything that they found. There was, this is where I wanted to talk about this. So there was exactly one paper in all of these studies, so 34 studies, there was one paper that looked at something that is called all-cause mortality. And that's a shame. Because
that's all you really care about at the end of the day.
And the reason that that's the only thing that you care about is because diagnosing and labeling a COVID case is a subjective matter. You have questions of PCR cycles, you have questions of scans, you have questions of financial incentives, you have questions of all of these different things that fold into, false negatives, false positives, whatever. You have all of these things that fold into your inability to accurately estimate the number of COVID deaths that you actually have. But if you look at actual deaths, then you would expect to be able to see the effect of your intervention, because if you prevent COVID deaths, and COVID is the leading cause of death in some given window, then you would expect to see a drop in all-cause mortality relative to no intervention. And there's only one study that looked at that, and that's really a shame. Like, there's very few studies across the board that looked at all-cause mortality. And
Which is ultimately, that's the cost-benefit analysis that you really need.
There's a really fascinating study that sometimes when in our spare time, we will talk to anti-vaxxers. And this one guy, he was really kind of kooky, but he brought forth a really, really fascinating study. And it was done in a Japanese nursing home. And they vaccinated the residents against pneumonia, viral pneumonia. And then they looked at all-cause mortality instead of mortality from viral pneumonia over the course of the next 3 years or something. And what they found is that the vaccination had absolutely no effect. People died less of viral pneumonia, but they didn't die less of anything, period. And that seems to suggest that even if you vaccinate them and you measure your benefit by saying like, hey, look, we're going to look at all-cause mortality, or we're going to look at viral pneumonia, obviously you're going to see a lower death rate because you vaccinated them against viral pneumonia. But if this person's body is already breaking down and they're already sick and they're likely to get sick and die no matter what it is that they encounter, then you would see that in the all-cause mortality. And so it was a really fascinating study that I haven't really seen repeated. It was a small study, one place. It's rare to find all-cause mortality because most of these papers are written by the companies or the researchers that are interested in demonstrating that their drugs or their interventions work.
Yeah, you can imagine this playing out in society to the extent that people get vaccinated against COVID and they think, I am completely safe against everything, because the only thing anybody even thinks hurts anybody is even talking about in the universe right now is COVID. And in reality, they could go out and contract any number of infectious diseases.
Or they could kill themselves because they're suffering in lockdown.
Right, because
we're looking at lockdown all-cause mortality. Is that what...
I mean, that's a totally different effect, but I'm just saying that people tend to, if they think that, if they're fixated on one cause of death and they think that they've been properly treated against it and they're safe against it, they tend to act more adventurously towards all infectious disease.
Wearing bicycle helmets actually increases the likelihood of there being a bicycle crash, because if you're not wearing the helmet, then you're constantly thinking about the fact that, you know, your head is a soft, juicy watermelon that you have to protect. But if you're wearing the helmet, it gives you this false sense of, Same thing with seatbelts. And like, there's
Like
definitely
brakes,
fewer
too.
fatalities on the roads because the cars are safer, but that's not because there's fewer accidents. In fact, people have more accidents because they feel counterintuitively safer.
I think there was this insurance company in Great Britain that was giving people, incentivizing them, giving them some discount for installing these super high-end brakes on their cars. And then it turned out that people, once they got the high-end brakes, they were like, yeah, we could just drive like crazy now.
Right?
So.
But what's wild is that this study that actually looked at all-cause mortality, it's the only one that looked at all-cause mortality, found a positive effect after 1 and 2 weeks, which suggests that if you close people down for 2 weeks and they can't see anybody and they're totally isolated where they are, that other bad things happen to them that are not related to COVID that might offset what's happening inside of COVID. And this meta-analysis would be maybe totally different if we could actually see all of these studies in context of all cause rather than just COVID mortality.
Positive effect means more death, by the way.
In this
it's
case,
kind of weird to hear positive and death in the same context.
This is why people don't like scientists. Do you know what I mean? Like, you find a phrase in a paper that's just like more positive effects, meaning more death, and you're like, my
why is that
goodness.
positive?
Yeah. How could you write that? And so basically this is like, we're not going to go through this table because I think that everybody would, their eyeballs and ears would fall out of their heads.
I mean,
The meta-analysis, the impact of lockdowns. I'm going to go, the quality dimensions. This is interesting. So what they did is, of these papers that they had, they recognized that not every single one of their papers was equally as good as...
This is how they got to 24 from 36.
Is that true?
I'm guessing.
No, I think that the way that they did is they excluded the working studies and only looked at the peer review ones.
Okay.
I think that might be it.
But that's one of the quality dimensions.
Oh, you're right. We'll get to that. But so they recognized that not all of their papers were sufficiently quality, and so they needed to be able to rank the papers in order to create a matrix by which they could weigh how much they should trust them. Because they were like, look, we have all of these meta-analyses. Not all of the meta-analyses will be functionally identical in terms of how well designed they are. So we have to be able to figure out how well designed they are, and so we have to give it a rubric in order to weigh it in our analysis. This part freaks me out a little bit.
Really?
Yeah, because I'm like, I think that you could construct many different rubrics of quality that would change the landscape of which papers you weighed more than others. And so
it goes from the top to bottom of this whole study design, though.
It does. But for some reason, because this is like the last and narrowest part where I'm like, other things
how many
are...
papers did they trim for this part? I think only 13 papers or something.
I think that this is all the papers here. This isn't a trimming thing. This is just like, this is how they
this
weigh
is a
them for their
ranking
mathematical
thing.
rankings. Yeah.
I see.
So they're looking at peer-reviewed versus working papers. And this is my first thought. I'm like, okay, so...
I will add, though, like the unweighted versus weighted difference was like 2.4% versus 0.2% or something. Like they were both pretty much concluding that the lockdowns did very little.
Right. I'll give
whether or not you do this quality control.
Yeah, that's true. So peer-reviewed versus working papers, they're like, peer-reviewed papers are better, which I'm just kind of like, maybe. Because peer review is a political process, right? We like to think that peer review is effective and that once something is passed through peer review that we can lean on it and we can trust it, but I've talked to enough scientists who have serious issues with peer review despite the fact that their papers get peer reviewed, right?
Especially like the anonymous peer review. And
yeah, there's a lot of political... We could teach a whole class on that, but we won't for today. Next time. Long versus short period, you have to... Because of the flatten the curve thing, you have to extend the window at which you look because your deaths might come later. And if you only look at the beginning of flattening the curve, you could pat yourself on the back and be like, we did a great job. But in reality, those deaths just came 2 weeks later, and you didn't actually do anything, but you did destroy the entire economy, and you did destroy people's lives, and you did prevent people from being able to live without constant fear. And so it's like you have to include those other papers. They also wanted to make sure that there weren't papers that had a super early effect on mortality, where it's like if you start your lockdown on March 1st and March 2nd, your deaths fall precipitously. What that tells you is not that lockdown was effective, because it takes 2 weeks for somebody to die from COVID, or to die with COVID, or to experience the full spectrum of symptoms. So you have to start your count 2 weeks later. And so they weighed the studies that started their count too soon after lockdowns began less stringently than the other ones. And then my last one is I love this. It's a dig basically at social scientists.
I think they like social scientists. They think social scientists are better equipped to answer these questions. Everybody's always taking digs at social scientists. So.
Sure.
We distinguish blah, blah, blah. We perceive the former social scientists as being better suited. I was actually really surprised at that. That's the only reason I remember that is that because people are always hating on social scientists, and these guys are like, we trust the social scientists know how to do this better than everybody else. I was
totally misread that. That's funny.
Interesting.
That's really funny. I like that they put do they consider economics a social science or a real science?
That's a great question.
Here we are sitting here evaluating real science. Economics is known as the dismal
social
science.
Scientists got in huge trouble. I don't know how many of you are aware of this, but there's this concept of p-hacking in science.
Social scientists make things up. Who wants to be a social scientist?
Come on, I don't think it's that clear cut. It's more like...
They do. They make things up all the time.
I think they find effects where there are none. And I think that could be said about everybody all the time. Anyways, it's...
Let's look at these tables, basically. So this is all the metadata stuff, moving right along. Stringency index. They just go on and on and on and on.
Yeah.
Okay. Overview of common estimates from studies based on stringency indices. So what they're looking for is they collect all of these papers, and they're looking at the estimate of the estimated averted deaths versus total deaths. And this is where we see our first indication that things are not as they seem, because they look at all of these different studies that they selected as being the only ones that are looking at this question, right? That's why we don't have all of the studies here. And they're like, it is a negative point, so it's 0.2% less, so 0.2% less deaths from lockdown versus not. And I was really thrown off by this because I was like, wait a second, but you have one of these here that's at minus 35%. Which suggests that it should be by all means greater than negative 0.2%.
Well, negative 0.2 is from their weighted stuff. But even their arithmetic average is negative 7.3. That makes sense. Most of them are, one's freaking 0. One of them's 0.1, 0.3, like those are going to drag the average down pretty
exactly.
bad. By the way, that 35%, who is that?
So this is Fuller et al., and it turns out that this is a paper published by the CDC. And I think that it is based off of the way that the CDC was kind of consistently shifting messaging over the course of the pandemic. And because of the immense public pressure for the CDC to demonstrate that lockdowns were the right thing to do, because it has to be something that they can justify to the public, as opposed to being like, well, we probably shouldn't have crashed the economy. This is a data point that I think is hard to look at from a purely objective standpoint. Like if it was a Pfizer data point that was talking about how good the vaccines are in a field of lots of other people that were looking at vaccine efficacy, I would also be very skeptical of that position, because you can't trust a fox in a hen house. People have motivations, and it's worth looking at the motivations in order when you're evaluating whether or not their conclusions can be trusted. They're also a huge outlier. Like, this is a graphical representation of the stringency indices. And so the Pfizer study is all the way out here, and it's also not a particularly trustworthy data point because its standard error is huge, which means that when they were doing the statistical analysis and they were processing all their data points, the spread of their estimates was really, really large. And that's another piece that suggests to you that perhaps this isn't the most robust paper, because the size of your error has to do with how precise your measurement is.
I mean, let's talk about incentive structures here for a second too. The CDC got an extraordinary amount of money from the bailout packages that were offered as a result of their conclusions. I mean, even if they're absolutely right, it doesn't look good. Like, the government asked the Fed, basically, to buy something like $2 trillion worth of bonds from them. And a lot of that money that they raised went to various healthcare services and CDC departments. And so they're certainly invested in making this look like a bigger problem than it is, or making this look like that they've been doing the right thing all along and so forth, that they're trustworthy and they're deserving of this money. So I'm not saying that was the case. I'm saying that it doesn't look good for them being the only outlier.
I would agree with that. Then after they looked at the stringency studies, they break them down again here based off of the different quality dimensions. And basically, no matter what quality dimension that you're looking at, except for maybe this like not very high quality, like only like 2 of 4, you get a -4% decrease. But again, if you average between all of these, then you get a much smaller estimate, right? And what you're doing is you're averaging all of them together in order to get your true estimate, and breaking them out according to quality in order to be able to say that, like, well, the ones that are the highest quality are probably the ones that we should trust the most, and the ones that are higher quality seem to suggest that there's a much smaller effect than the ones of less quality.
Even if we take the worst case scenarios, we have to start asking ourselves if those are worth the costs too. I want to make sure we save a little bit of time to go over the costs of all of this.
We've got a couple more tables and then let's do it. Again, with like the shelter-in-place orders, we see the opposite effect. We see that they can measure, depending on how they're measuring this, they can actually see that these sorts of precautions are causing greater deaths rather than fewer deaths. And so if you average the two types of interventions together, then you get, again, that there's almost nothing happening. This is again like based off of quality, and consistently it seems like if you have lower quality studies that you're going to start seeing a higher estimate. And that would make sense because if you have fewer of these stringent controls on the quality of the way that you're collecting your data, the likelihood is that you're going to come up with some kind of version of events that is more extreme than the reality because it's according to the prevailing winds, right? We've seen this over and over again over the course of the semester. And then the last thing that they really looked at was that they tried to break down all of the different non-lockdown initiatives that various countries did, right? So we have a bunch of different things here. We have lockdowns, face masks, business closures, border closures, school closures, and limiting gatherings. And something that really struck me was that limiting gatherings appeared to cause an increase in deaths. And there was not really a trend for anything except for employees wearing face masks. So there didn't seem to be any support for you wearing a face mask when you go into the store, but there did seem to be support for the person who's in the store all the time. And I think that a lot of that is masked socioeconomic stuff, because the person who's the essential worker is the person who is in a worse socioeconomic class than the person who's coming in and out of the store. Most of the times people are working at places that they don't necessarily shop. They're not the demographic of that store. And so it would make sense that if you're part of a lower socioeconomic class, you're working shift work, you don't have access to medicine and nutrition as well as somebody else that does, who has the money to shop.
I mean, from a basic germ theory perspective too, like the pivot point's going to be the most vulnerable point.
Yeah, absolutely.
I'm not sure if that works out in this case, but from a basic germ theory perspective, it makes sense.
And then they also suggest that closing bars and restaurants did a lot of good.
Also pivot points, like huge transit points where lots of people are coming into close contact, over and over throughout the night. It's a huge exchange point. People come from all over the city to one point.
I would go even farther and say that the people who are going out to bars and restaurants on a regular basis are less healthy than those that are sitting at home. Like, I think that if you're drinking regularly, I think if you're eating out all the time, and so your N of like the number of times that you visit these places, you're just going to be sicker. Like, I used to drink a lot when I was in college, and I know that it was a worse time for my body than when I wasn't drinking. And so to me, it's really, really clear that it's like the people that spend all their time in bars, they're going to be more susceptible than the people that don't. And so if you block those, then things change. And with that, I think that that's kind of I think that's the heart of it.
I'll talk about the conclusions, but this is the most interesting thing on the whole paper to me. I'm just going to start. I'll just start right at discussion. See that, page 40. So it's clear that at least from this analysis, even if we take the CDC's estimate of a 30% improvement in mortality, which seems to be there's reasons to doubt that, but it seems like the effects were rather minimal. And so the authors are like, why is that the case? They start off their discussion, though, by pointing out the fact that this seems to have been the case from the previous pandemic as well. And I just want to read this little quote from the WHO, which says, this is in 2006, they wrote, reports from the 1918 influenza pandemic indicate that social distancing measures didn't stop or appear to dramatically reduce transmission. In Edmonton, Canada, isolation and quarantine were instituted, public meetings were banned, schools, churches, colleges, theaters, and other public gathering places were closed, and business hours were restricted without obvious impact on the epidemic. So this is what I think is just so crazy. It doesn't make sense, right? If we take the basic contagious principles, why don't these things work? And so the authors have a couple of cool ideas, and I want to ask you guys to right now think about other alternatives too, because this is going to be really interesting if we can come up with some other reasons why lockdowns don't work. They say, first, people essentially respond intuitively to what they perceive as dangerous. Regardless of what some government says, people are going to behave themselves. So maybe the lockdowns didn't work because people were already behaving themselves. That's their first idea, which is kind of crazy. It's like, wow, yeah, that makes sense. Yeah, people are scared. They're going to probably wash their hands and stuff or whatever. They're going to stay away from people who are hacking and coughing, right? Because they're like, oh my goodness, there's a pandemic going on. So that means that the background rate is already extremely low in terms of what you're going to be able to restrict when you mandate stuff. All right. Second of all, they say that mandates actually only focus on and target a tiny fraction of potential contagious contacts, which is also kind of mind-bending. But they don't really do anything. They don't enforce hand washing. They don't enforce the way that people cough. They don't enforce how far away people stay apart from each other when they're out shopping or anything like that. So they're just these very haphazard guidelines, right? They're like, stay home unless you can't, or something like that. Third, they say even if they're initially able to reduce the spread of COVID-19, this might people will respond. What is it? Hold on, let me read this.
Basically what happens is that if the lockdown works at first and it stops people from dying, what's going to happen is that people are going to revert their behavior and they're going to be like, oh, well, there's nothing to worry about, right?
Right. So as this initial success surfaces, they think that they can lower their guard, basically.
Mm-hmm.
So basically you get a false sense of security from these lockdowns. Oh, it's not that big of a pandemic. We got it under control. Okay. And then the fourth reason is a little bit more nebulous. Lockdowns may have all these secondary effects, like you're closing places where people actually do healthy things, like outdoor spaces, beach, parks, zoos. There's just all of these things, like people socializing is actually good for them. What else do they say?
They're basically like, look, if you shut people inside their houses in close proximity to family members, then there's the chance that what's going to happen when they're there is that they're going to be infecting each other, or they're going to get together with their friends in these closed spaces, as opposed to going somewhere outside. Like in Oregon, I don't know if you guys remember this, but they closed all the forests. The idea during the first 2 weeks to flatten the curve, which extended out to 6 months, was that they didn't want people being in accidents and filling up the hospitals that were necessary for the COVID patients. And so it was basically a case of, well, on one hand, you'll lower car accident deaths, but on the other hand, you might be causing other things to happen. Do you want to go over to that other paper?
Yeah, let's do it.
Let's
put it in the drive if you want to open it up.
All right, I'm going to... Can you drop it in the...
Well, it's the paper that I marked up, so you have to look at my marked up
I
version.
see. Got it.
So... I just want to give some sense of the costs. We don't have to go through this in detail. It was obviously a very costly pandemic on many fronts. This is going to essentially just talk about the impacts in different economic sectors. And then I want to talk a little bit about the bailouts and how that worked. And then let's just open the floor. And I really want to hear from people. I want to hear from all you guys about why you think that these procedures didn't work,
or
how
the
these
other
costs
things
could
that
be
happened.
mitigated.
Or the other, right? Because the socioeconomic costs is a very, very difficult thing to determine. There's some studies that show that, Black and Hispanic members of our society had much worse outcomes than did the white people. There's a lot of indication that people of lower socioeconomic classes had much worse outcomes than those of higher economic status. There is a load of stuff that correlates perfectly well with everything that we already knew about other diseases, right? Where it's like, if you are of a racial minority in this country, you tend to have worse health outcomes. That's known. But there's a lot of other stuff that's happening now that I think that people are experiencing on the ground rather than being written about in peer-reviewed papers as of now.
Unfortunately, can we do the zoom on it maybe?
That's as zoomy as we get.
All right, so essentially all of these different industries were impacted negatively.
Which industries, sorry?
So they go through them one by one. Petroleum and oil. These are just standard breakdowns that economists use to look at. It's a very national industry-based approach, which is unfortunately the best I could find. Manufacturing industry. Let's keep going. Education. The education was actually one of the worst ones. Many of you probably have either firsthand experienced this or your siblings experienced this. It seems like they estimated that 900 million learners have been affected by closures of educational institutions. And it's really hard to quantify what that means in terms of cost to the future, in terms of what that means about people's ability to affect economic growth in the future as a result of delayed development. I don't even know how you hang a number on that. I just, this is the best we've done. Pay cuts, this is a study from Dubai, and these are all anecdotal, right? They're just pulling from different countries and so forth. Pay cuts as high as 50%. People are out of work, and so parents can't keep their kids. They're not even able to pay for the schooling. Let's keep going. They talk about the impact on science and academic work, which is essentially that a lot of health research was shunted towards studying COVID. So research into other diseases was put on the sideline a little bit. Scientific conferences across the world were canceled or postponed. The Zoom conferences, talking to anybody who's been to them, were quite a bit less effective than the in-person conferences, because a huge part of going to a scientific conference is milling around and talking to people who are working on your project and getting ideas from them, not necessarily presentations. So we'll talk about the finance industry in a little bit. This is actually one of the few places where you see a positive, sorry, I didn't mean to highlight that. One of the few places that you see a positive impact was in the finance industry. And it only happened after the different banking systems started to bail out business. So the stock market was crashing, and the US signed this CARES Act, and these indices immediately rebounded by almost 10%. Same thing happened in Germany. Same thing happened everywhere, basically. European Bank Council, Europe, where else? I mean, these are huge amounts too. $750 billion asset purchase program. Just to give you some extent, that huge crash we had, or some scale for this, the huge crash we had in 2008 that everybody talks about, the buyout from that was somewhere on the order of $500 billion. So each one of these countries are pledging way more than that. Like I said, the U.S. CARES Act was $2 trillion. That's 4 times the amount of money spent during the subprime mortgage disaster. So this is interesting. That's one of the only industries that bounced back, was the finance industry. Let's keep going here. And then I want to maybe this is a good time to talk about those. So what exactly happened with the money that was actually unleashed into the world at that time? So $2 trillion, there's a cost ostensibly of $2 trillion for this buyout package. What does that mean exactly, though? And where did it all go to? And I think this paper does a good job of summarizing where all of the that money went to. It doesn't really talk about where it came from, and that's a kind of an open-ended question. Let's talk about the U.S., though, not Great Britain. Here we go. So the U.S. spent a lot of money to deal with the damage that was incurred, not entirely from lockdown, but it seems like at least in large part from lockdown. So some of these huge costs, like $377 billion to small businesses and emergency grants. Well, why is that? Why do these small businesses need emergency grants? Well, obviously because their businesses were closed, right? So a lot of these costs are directly associated with lockdowns. That's why I want to bring this paper in more than anything, is to show you that these are extraordinary figures. This is almost as much, this amount of loans that was given to small businesses and large businesses was almost as much as the subprime mortgage disaster alone. These are huge amounts of money. So the costs are extraordinary, actually. And those costs wouldn't have been there without lockdowns too. So if we take the last study seriously, that the lockdowns were essentially ineffective, well, not only were they ineffective, but they cost more than anything in the history of ever, essentially, like by 4x. That's crazy. So I don't know if we need to beat on this horse too much more, but I do want you to understand the scale of the costs involved in the lockdown. $14 billion to farmers, $17 billion to national security.
And a lot of this is based on a theory called modern monetary theory.
This is where the money came from. So now we're starting to talk about where do you even get $2 trillion to give the government? Where does the government get $2 trillion in the first place?
Modern monetary theory says that because we live and operate on what's called a fiduciary currency, which means that you have a paper paper money that's not exchangeable for gold, right? Like you cannot go to a bank and ask for fiat in exchange for your paper. You can only deal with paper. The idea is that it's basically works because people believe in it. And so you can create a nearly infinite amount of this money because as long as people continue to believe in it, then you never have to go through this like boom bust crisis because you're able to kind of patch over holes inside of the economy and have them work out. This is an experiment. We've never had this before. Normally when countries print money, they are on a gold system. And so what happens at some point is that people want to exchange their money and there's a run on the banks. And when there's a run on the banks fail because they don't actually have enough gold in their vaults to cover it. But we don't have that problem right now. Right now we live in a world of faith-based currency. And so this is one of those cases where if everybody believes that the dollar is still worth something, then the dollar will still be worth something no matter how many you print, because it was never worth that in the first place, because you could never exchange it for gold and get outside of this frame of the dollar. And so what we're living through is an immense economic experiment that was developed, it's a model, it's a theory. And we will see if it bears out or not, because now we're talking about inflation, we're talking about the dollar crashing, we're talking about all kinds of things. There's other countries that are starting to switch over to fiat currencies. They're promising that they can back I think that Russia has now promised...
Fiat means, I think there's a little terminology confusion here. So fiat means that it's not backed by any commodity.
Oh, I'm sorry.
Yeah, so you were like misspeaking just a little bit about that.
Oh, I'm sorry.
It's okay. So
what's the word for it then?
For the opposite of fiat?
Mm-hmm.
That's a good question. I mean, let's go over this a little bit about what it means to be printing money. So the way that the US government raises money, or really most governments raise money, is they sell bonds, which means you're basically you're taking on some of the government's debt yourself, and they'll pay you back at some profit, right? Some interest rate. And they also do taxes. Well, they don't do enough taxes to have $2 trillion to spend on fixing stuff. But they do... What's that?
It's a gold standard. Fiat versus gold standard.
Oh, okay. It's called gold standard. So what they did was they sold a ton of bonds to the Federal Reserve Bank. Now, what's interesting is that the Federal Reserve Bank has essentially unlimited buying power because, like you said, they're able to print money. So they bought basically all of these bonds. The only reason bonds are even worth anything is because they have like a interest rate associated with them, which means that people can make money off them over time, right? So if you buy them, you basically are saying, I believe in this government because it's going to be around to pay me back. Funny thing is that the Treasury Department by law, the Fed by law has to give all of its bond profits back to the Treasury Department at the end of the day. So this is essentially one of those cases of like robbing Peter to pay Paul, where all the money that these bonds are making is going to go right back to the government at the end. So it really is a case of this money just appearing out of nowhere, essentially. It's like you're selling stuff you're selling bonds to yourself.
And the crazy thing is that it might actually work.
That's right. So it hasn't worked out in some cases, like in Weimar Germany, but it has worked out in other places. I think was on a gold standard. What's that?
I think Weimar Germany the Deutschmark was on a gold standard.
They started just printing them at some point. So I was reading an interesting case. I actually I put a New York Times article in the piece there. But there's been several different cases of where this printing money business has worked out and several where it hasn't worked out. The New York Times listed the Weimar Germany as a good case of it not working out.
This is inflation in Weimar Germany. So we're talking about after World War I, and this is the value of one piece of gold versus a paper mark. The currency was the mark. And so in 1918, you see that there's basically like a one-to-one relationship between a mark and a piece of gold. And then you go all the way up to needing, what is this, $1 trillion marks in
I
order
mean, people
to
were
get.
just burning these things to stay warm at some point. 'Cause they were just completely worthless, basically.
Yeah, like it was cheaper to wallpaper your house with marks than it was to
buy
actually
wallpaper.
buy wallpaper. And so this is when people talk about inflation, this is the example of what they're worrying about. But I think that it's worth recognizing that a lot of this has to do with the fact that people were they suddenly left the gold standard. It was a country that had always had a thing where it was like one piece of currency can be exchanged for one piece of gold. And Germany didn't have enough gold in its vaults to back all of the currency that they printed, and so they just kind of left the gold standard.
Well, neither do we. We haven't been on the gold standard since the early 1900s.
Which I think makes it a different situation.
I think what makes it a different situation is everybody hated Germany at the time. Really,
true.
I think that they didn't have the support of all of the other banking systems around them. I think that the robustness of this system is that these national banking systems are all buoyed by one another.
Yeah.
And so, like, it is a faith-based system, right? But as long as the rest of the world has faith in your country, then life goes on.
That's why you got to be friends with all of your countries.
This is a real matter of debate. You know, there are some extremely liberal politicians that think that we could run past the budget. We could run the budget into the deficit way harder than we are right now, and we could be living a lot better. Of course, most conservative politicians are like, you guys are crazy. What are you doing? So, you know, it's an open discussion. It does seem to be a case of it works until it doesn't.
Yeah.
But there's no exact science to it. So anyways, I think that we only have 25 minutes left of class. Let's just talk and hear your thoughts.
Yeah.
Hopefully you got a good sense for the costs and the benefits and everything in between, but let's talk about it.